Lung transplantation is a complex surgical procedure that involves replacing one or both damaged or diseased lungs with healthy lungs from a deceased donor. The primary purpose of lung transplantation is to improve the quality of life and survival of individuals with end-stage lung diseases that cannot be adequately managed through other medical treatments. The lung transplantation procedure typically involves the following steps. 1. Patient evaluation. The first step is an extensive evaluation of the patient to determine their eligibility for lung transplantation. This evaluation includes medical history, physical examination, imaging tests, lung function tests, and other necessary assessments. The patient's overall health, lung condition, and ability to tolerate the surgery and post-transplant medications are evaluated. 2. Waiting list and donor matching. Once the patient is deemed suitable for transplantation, they are placed on the lung transplant waiting list maintained by the National Organ Transplant Registry. The allocation of donor lungs is based on factors such as the severity of the recipient's condition, blood type compatibility, and size matching between the donor and recipient. 3. Surgery day. When suitable donor lungs become available, the transplant team notifies the recipient to prepare for the surgery. The patient is admitted to the hospital, and the surgical team begins preparing for the operation. 4. Anesthesia and incision. The patient is placed under general anesthesia, and the surgical team makes an incision on the chest to gain access to the lungs. 5. Removal of diseased lungs. The damaged or diseased lungs are removed carefully. In cases of bilateral lung transplantation, both lungs replaced, both native lungs are removed. In some cases, a single lung transplant may be performed, and the recipient retains one native lung. 6. Implantation of donor lungs. The donor lungs are transported to the recipient's hospital, where they are prepared for transplantation. The transplant team connects the blood vessels and airways of the donor lungs to the recipient's chest. This step requires meticulous surgical skill and precision. 7. Recovery and post-transplant care. After the surgery, the patient is taken to the intensive care unit, ICU, for close monitoring. The recovery period can vary depending on individual factors, but it generally involves a hospital stay of several weeks. The patient receives immunosuppressive medications to prevent organ rejection. 8. Rehabilitation. Following hospital discharge, patients undergo a rehabilitation program to regain strength, lung function, and adapt to the new lungs. 9. Follow-up care. Lung transplant recipients require lifelong medical follow-up and immunosuppressive therapy to prevent rejection and manage potential complications. While lung transplantation has come a long way in improving the lives of patients with end-stage lung diseases, it still poses several challenges. These include a shortage of suitable donor organs, the risk of rejection, infections, and side effects of immunosuppressive medications. Researchers continue to work on advancements to make lung transplantation safer and more accessible to those in need.